Welcome to our monthly In Focus COVID-19 update. Once a month, we devote our segment to the pandemic and bring you stories that you may not be aware of or stories that deserve a little bit more attention. Tonight, there will be an emphasis on people with long COVID. Those are people who suffer from long-term debilitating symptoms even after they are considered recovered from the virus. And now we're seeing these cases in children. Up first in our conversation are Arabella Fisher and her mother Brandy. Arabella, who is 12, suffers from long COVID. And thank you both for being with us tonight. We'll start with you, Brandy. Can you tell us about how Arabella caught COVID and what are some of her current symptoms?
Yes, so Arabella contracted COVID last August, or not last August, I apologize, August of 2020. Our entire family had been home and isolating and working from home, although my mother and father live in my basement, and my dad is a salesman and he had to continue to work for a short time. Unfortunately, he contracted COVID at one of his cells. He got very sick, as did Arabella, right at his 10 to 14 day mark after he had initially contracted it. Thankfully, nobody else in the house had got COVID, but interestingly enough, she had a very, very mild case. Usually she has a more severe illness with a cold or something along those lines, but the COVID itself was just a bit of a sore throat and some runny nose, slight fatigue. She recovered. We thought we were in the clear, only to have about 5 weeks later or so, she started developing all kinds of worrisome symptoms, such as swelling. Her fingers started swelling at first, and then her toes. She started getting these weird rashes and marks on her face and her neck, and her little fingers started developing sores and turning purple and red. Chest pains started. All kinds of worrisome things. And she still currently is experiencing some swelling, daily pain to some level, as well as fatigue, brain fog, things along those lines. There has been improvement with therapies, but it is still there, 13, 14 months out.
Wow. Arabella, what has it been like to have these lingering effects for you? How has it changed your life or impacted your life on a day-to-day basis?
Well, to be honest, it's been pretty hard. I can't do normal things like normal kids can do. I can't play as easy because my feet just start hurting on end, and to the point I can't even walk without severe pain. And I have lots of random things like I can't even do schoolwork since my fingers just start hurting, or my knees hurt to sit or stand or do anything. And I forget things a lot, and like I could just be eating something and then forget it completely about it, or random things like that.
Arabella, I'm so sorry to hear that you're going through this. Like, no one, especially you, should have to go through this. And Brandy, as her mother, you've had to become an expert in long COVID. Obviously, you were probably trying to piece this all together, especially when this was happening. You were probably thinking, what is this? When did you make the connection that this was long COVID, and what have you learned since then?
You know, it was pretty early on, so you do have to be an advocate, and you do have to be persistent in a lot of cases. As soon as she started having chest pains, that was incredibly worrisome. We had already consulted doctors with the rashes and the swelling, and we were waiting for appointments, but once the chest pains and things started, we went up to primaries. We actually had multiple visits at primaries where I had to really advocate, and not because we weren't getting amazing care, it's that at the time, you know, she wasn't Miss C. She wasn't in dire straits. She wasn't in urgent danger, and so they didn't know. There's a lot of things we still don't know. And so as things kept progressing, we finally got a call saying that there was a rheumatologist at primaries that is specializing in long COVID, or pediatric long haulers. And so we started our journey of multiple specialists and weekly therapies, which had gone on pretty much throughout the year until now. We've had to halt those due to risk factors. We've got a little sister at home that's not able to be vaccinated yet, and without knowing how she will respond to COVID, we've got to take things quite seriously. So poor Arabella's had to stop those therapies, which helped quite a great deal in order in order to help keep everybody safe. So it's been tough. It's been tough, and part of that learning experience and that advocacy is, joining those support groups and finding these things that are so bizarre and seem unconnected, but yet they are. For example, for some reason, there's a lot of these long haulers that all got sick between May and September of 20. And now all of a sudden, here we are almost a year plus out, and they're developing this weird foot pain that's completely inexplicable. We've been through all specialists at primaries, and everybody's perplexed. They have no idea yet. Multitudes of these long haulers are experiencing this. So there's all these little things that are just, you've got to keep on top of stuff and find out new things that are developing. And one of the most disheartening things that I learned during this process is just, it surprises me how truly unkind some people can be. People that are surprising to learn about that, because this whole journey, even as recently as yesterday, we have people, family, friends, church members, community, looking us in the face and calling us liars, telling us COVID is fake, and it's very disheartening. It's very, very disheartening.
Well, because it minimalizes these lived experiences that you're facing every single day. And, I'm so glad to hear that there are support groups, because this experience can be very isolating. And I'm glad that we have you two on the show, so that if anyone is going through this, they feel alone, they feel like they are the only ones who are going through this, they know that there are support groups out there. And Arabella, we have to wrap, but I want to give you the last word. What is your message to our audience tonight, or what do you want to leave our viewers with?
I would just like to say, and for everybody to understand, that COVID is real, and kids do get COVID and can get sick. But if, for whatever reason, if you can't get vaccinated, to at least please wear a mask. Everybody wants to be able to go back to school and everything to go back to normal, but we can't. And without people getting vaccinated or at least wearing a mask. So at least wear a mask. I do, but not just to protect me, but protect everybody else.
You've been hearing from Arabella Fisher, who suffers from long COVID, and her mother, Brandy Fisher. And Arabella, I know it was tough for you to make the trek down here, but you're sharing a very important message. Thank you to you both for being here tonight. And Arabella, we wish you a quick recovery soon.
Thank you.
Thank you.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on our September COVID-19 update. We continue our conversation on long COVID with Dr. Brayden Yellman, a post-viral syndrome specialist with the Bateman Horne Center. And Dr. Yellman, thank you so much for being here tonight. I'd like to start the conversation with talking about the risks of catching COVID. What do the numbers say about the possibility of having lingering effects from the disease, and how many of those are children?
Well, Rosie, thank you for having me on. As a lot of us are aware, we've been dealing with COVID now for over 18 months, and it's a pretty ubiquitous virus, so the risks are very high. But they say that about 230 million Americans have already caught COVID-19 at least once. It's important to point out that you can catch it a second time or a third time, and that it can be caught even if you are vaccinated, although those risks are significantly decreased with vaccination. Among those 230 million Americans who have caught COVID-19, there are very good studies estimating approximately 10 to 30% of those people will go on to develop long-term symptoms. And these are actually symptoms that are cropping up long after the virus has cleared and after the initial infection is over, even when that infection was extremely mild and when there were no issues of hospitalization. So approximately 10 to 30% of these Americans will go on to have debilitating symptoms that end up keeping them out of work and school for months, if not years, or chronically.
Those odds are pretty high. So in terms of symptoms, what are you seeing in terms of these long COVID symptoms?
There's been a lot of different studies looking at symptoms reported by patients, and the symptoms are myriad, to say the least. Over 90 different symptoms have been reported, but they tend to fall into some categories. We're seeing a lot of dysfunction of the autonomic nervous system, which controls things like blood pressure and blood flow to the brain. It controls the control of your gut functions, controls how your nerves work. We're seeing lots of fatigue, lots of brain fog, cognitive dysfunction, allergic reactions known as mast cell activation syndrome, problems with palpitations, chest pain, breathing issues, rashes, joint pains, among many other symptoms.
And these are symptoms that affect your day-to-day actions. It makes it really difficult to do what Arabella said, go to school, be a kid, right? Engage in sports and things like that that can really change your quality of life. Can you compare these long-term effects to other diseases like fibromyalgia or chronic fatigue syndrome? What's similar and what's different?
Right, so chronic fatigue syndrome is a name for a disease we now call ME/CFS, or myalgic encephalomyelitis chronic fatigue syndrome. And that is essentially a disease that will often happen after exposure to a virus, although not always. Sometimes it can happen after a traumatic brain injury or other kind of traumatic event in someone's life. But there appears to be a change in the autonomic nervous system, neurological functioning, in the immune system, and the way the metabolic system works in this illness. And this is more or less what we're seeing in long COVID. People are getting exposed to the virus, they're recovering from the virus, and then having their body react to that initial infection in a deleterious way that leaves long-lasting effects. The major differences we think about are in reference to damage from the COVID-19 virus itself, and some of those damages may not be the same as infection with other viruses.
So how do you treat long COVID? Is it a different technique than what you would use with ME/CFS?
We are seeing a lot of long COVID patients in our clinics right now, given our experience with post-viral illnesses, and we are applying many of the same techniques that we use to treat post-viral illnesses to those with long COVID. In particular, we do a lot to try to adapt people's autonomic nervous systems to help them stay upright, help their blood flow be more effective. We're doing, giving treatments to try to decrease inflammation, specifically in the brain. We're giving treatments to reduce overactivity of the immune system without significant immune suppression. And we are seeing very positive results in many of those patients.
Dr. Yellman, what should someone do if they think they might have long COVID?
Well, the most important thing to do if you think you have long COVID and you're feeling really sick is to not push through it. We have something in our society where we think we still need to go to school, we still need to go to work, we need to push through and be tough. And strangely for this illness, that is the wrong thing to do. That seems to be associated with worsened long-term functional prognosis. So if you are feeling sick, take time off of work, take time off of school, consult a physician, but also don't be discouraged if the first physician you see isn't quite sure what's going on. One of the reasons these illnesses are so difficult is because there's not a direct lab test or imaging study that can make the diagnosis. And I can tell you, I trained for 9 years in the medical field and didn't even learn about ME/CFS, essentially a long COVID similar illness, in any of my years of training. It was only after I was out in practice that I began to start learning about it. So many physicians haven't been exposed to this and may say, oh, well, this is all in your head, or I don't know what this is, therefore it can't be as severe as it feels. Don't be discouraged if that happens. Keep looking for other opinions. Consider going to our website at batemanhorncenter.org. That's BATEMANHORNE center.org. We have lots of resources there that you can share with your physicians, that you can share with family members who might not believe you, as we heard in the earlier story there, and that can be used to try to get you some answers. There's support groups and information there as well to find others who might be experiencing similar symptoms.
A lot of resources and support available. You've been hearing from Dr. Brayden Yellman, a post-viral syndrome specialist with the Bateman Horne Center. And Dr. Yellman, thank you for being a part of our discussion and spending your Friday evening with us.
Thank you so much, Rosie.
We'll be right back. Welcome back to our In Focus discussion on our September COVID-19 update. The scientific research that surrounds the pandemic can be broad. Some can be obvious, like vaccine research, and some is adjacent, like mathematical modeling of the virus's spread. Joining us now via Zoom is Dr. Margot Ridgey, a postdoctoral fellow of biochemistry at the University of Utah, to talk about a COVID visualization project. Dr. Ridgey, thank you so much for being with us tonight. And first off, can you share with us the work that you do at the lab? Why is biological-based animation so important?
So thank you for having me tonight. And the animation lab is a bit of an atypical lab in the sense that we don't carry experiments at the bench ourselves, as most of other biologists can do. We actually use the result of other researchers to create database animations that capture their current hypothesis, mostly on molecular and cellular processes. And our visualization can have various applications in research, education, or outreach. But regardless of the application, visualization is important because it makes the invisible visible. And that helps bringing clarity regardless of the background of the viewer.
We're excited to see some of these animations. Talk about the project on the COVID-19 virus that you have been working on. Who has been contributing to it?
So this particular project was initiated by the head of the animation lab, Professor Janet Iwasa, very early in the pandemic last year. We started in March 2020. And a funny thing that also highlights that research on coronavirus has been going on a bit behind the scenes for longer than one could have imagined. She had already been working on a shorter animation depicting how coronavirus enters human cells even before the pandemic started. So that shorter animation was a bit the seed of a bigger project to create a detailed animation of the whole life cycle of SARS-CoV-2. And on top of Janet and myself, this project involved a third person, another postdoc from the lab, Dr. Ann Liu.
So let's talk about a couple of key points in your animations. Tell us what's going on there.
So here we're starting by depicting what's happening very early, at the very beginning of the life cycle of the virus. You can see the viral particle that binds a human cell. So a green molecule on the virus, which is on top of the screen, can recognize a specific protein on the human cell, which is shown here in purple. And this leads to a cascade of events. And ultimately, the entry of the virus inside the cell that you'll be able to see in a moment. And that's really a key event in the virus life cycle, because viruses can't survive by themselves if they're not inside a host cell. And that was also the part of the animation for which we had the most data to work from. And all of the different molecules you can see, we didn't imagine their shape. We used experimental data to build the structure you can see on the screen.
These animations are so cool. Now the science it's not settled on a lot of how the virus works. So you address that in the animation. What does that look like?
Yeah, so the entry process you just seen before was relatively well understood, but there's still indeed much unknown. And that was a real big challenge for us. So sometimes there's a complete gap complete knowledge gap, and we have to fill that in. So for example, now you can see on the screen a big molecule that is being cut in smaller ones. So that was known, but we didn't know exactly in which order the cuts were happening. And other times we had we have competing, more defined hypotheses that we chose to depict either simultaneously on the screen, as you'll be able to see in a moment. Like here, we show that the virus are able to remodel the membranes of the host cell. But there's two main hypotheses of how that happens, how these vesicles are formed. And we depict here, we managed to depict the two hypotheses at the same time, but sometimes it would have been too overwhelming. So we made another design choice. We're showing first one hypothesis and then a second hypothesis later in the animation.
That is so neat.
And I think an important message is that our animations are almost never an absolute consensus, but it's also never fully fictional. It's always kind of a constant work in progress, if you want.
Well, talk about the intersection of science and art and visualization. Do you look for the beauty in science? And we have about 30 seconds left, so hopefully we can get your answer in before we have to go to break.
Yeah, so very fast, as a scientist myself, I don't think I really need to look for beauty in science. I think it's there intrinsically. But in my everyday life, I think I mostly need to look for clarity in science, which is much more difficult to achieve. And making things compelling is more a way to catch the attention of a broader public into scientific questions.
Well said. You've certainly gotten my attention. You've been hearing from Dr. Margot Ridgie, postdoctorate fellow of biochemistry at the University of Utah. And Dr. Ridgie, thank you so much for joining us to share your work. We appreciate you spending your Friday evening with us.
Thank you for having me, for the opportunity to talk about my work.
We'll be right back.